Enacting policies relating to factual, mature sex education and the legalization or decriminalization of sex work will vastly improve conditions and safety for sex workers, as well as decrease rates of pregnancy, sexual and physical violence, and the transmission of STDs. The first step to providing sex workers with proper rights is to institute national policies on factual, informative sex education. This will serve to destigmatize sex and provide future and current sex workers with the knowledge they need in order to protect themselves. The institution of factual and mature sex education and eradicating abstinence-only sex ed is extremely important. Only 29 states currently require public schools to teach sex ed, and only 22 of them require that sex ed must be medically, technically, or factually accurate. And 36 states allow parents to opt their children out of receiving sex ed. The United States has the highest rate of teen pregnancy in the industrialized world, and 40% of high school students report that they have had sex, while only 54% reported using a condom and 30% reported use of other forms of birth control. These are some policies that could help diminish these issues. All states must provide a comprehensive, in-depth, factually accurate, and age-appropriate sex education, including but not limited to male and female anatomy, menstruation and menopause, pregnancy and childbirth, their risks and their effects on the body, the transmission, prevention, and dangers of all STDs and STIs, different types of birth control, exactly how they work, and how effective they are, non-judgmental human sexuality curriculum, the promotion and development of healthy relationships, abusive behaviors in relationships, and consent. The curriculum must be presented by a certified professional or approved by a leading professional organization or agency, and parents will not be able to opt out on behalf of their children. The impact of these policies would be significant. Research published by the Public Library of Science shows that when sex education is comprehensive, students feel more informed, make safer choices, and have healthier outcomes, resulting in fewer unplanned pregnancies and more protection against sexually transmitted diseases and infections. States that stress abstinence-only sex education tend to have the highest rates of teenage pregnancy and STDs, while states that require comprehensive sex ed tend to have the lowest. When sex education is comprehensive and includes information about contraception, teens had a lower risk of pregnancy than those who received abstinence-only or no sex ed. And teens who received comprehensive sex ed are also less likely to have engaged in sexual intercourse. The presented curriculum will foster a generation of youth with a much better, more responsible understanding of sex and sexuality. Once the taboo of sex is eradicated, it will be much easier to work towards removing the stigma from sex work as well. The legalization of sex work is much more complicated than the decriminalization of it, and still risks disallowing sex workers their rights by regulating their bodies, but it still provides them protection and provides a much more structured system in regards to regulations. We might likely follow the guidelines in place in areas of Australia, such as Queensland and Victoria. If sex work were legalized, some of the policies that should be enacted to protect sex workers and their rights would be: sex workers must be registered to perform their work and must have a blood test for STDs before receiving their license. Random checks of a worker's credentials are allowed, and if a person provides sex work without a license or while their license is suspended, they face up to 5 years imprisonment. The enforcement of quarterly blood tests and monthly swab tests for STDs. If a worker does not comply with blood tests or swab tests, their license to provide services will be suspended. We would provide free contraception and condoms to sex workers, and condoms would be mandatory in brothels. Brothels and sex work agencies must be inspected annually and obtain a permit in order to practice. Sex work must only be performed and received by adults 18+, no matter what a state considers a minor. Violation of this will result in the violator facing a minimum of 10 years imprisonment. Any person found to be forcing someone into sex work will result in a minimum of 5 years imprisonment. But if the person forced into sex work is found to be a child, this is increased to 10 years. Children over the age of 18 months must not be allowed in a brothel. If a person is found to be intimidating, insulting, or harassing a sex worker, they face up to 3 months imprisonment. Advertisements for sex work services must not be broadcast or televised and must not describe the services offered. A person who provides or receives sex work must ensure that they have taken reasonable steps to ensure a condom or some other device that restricts the spread of STDs will be used. If a brothel or sex work agency allows a sex worker who is infected with an STD or STI to provide services, they will face a hefty fine and potentially face having their establishment shut down. And if a sex worker working on their own knowingly continues providing services while infected, they will have their license taken away permanently and face up to 5 years in prison. Besides these regulations, brothels will be subject to the same laws as any other businesses, such as occupational health and safety standards, taxes, unemployment zoning laws, and sex workers performing services individually would be considered self-employed. The above policies would impact the lives of sex workers greatly. Criminalization of sex work significantly increases a sex worker's risk of being infected with an STD or an STI. Legalization and decriminalization will decrease the transmission rates of STDs and STIs. When sex work is illegal in the U.S., a condom found on a sex worker is enough to indict them, which leads to sex workers not carrying condoms with them for fear of being detained and searched. This leads to sex workers being forced to have sex with no protection. The enforcement of STD testing and use of protection will significantly decrease the transmission of STDs among sex workers and clients. Sex workers also feel much safer and more able to enforce safer sex with their clients, and legalizing sex work would decrease sexual and physical violence towards sex workers significantly. Legalizing or decriminalizing sex work in the United States would help vastly improve the lives and safety of sex workers and their clients. There is no evidence to support that it would increase rates of sex work or human trafficking. In fact, there is evidence that supports the legalization or decriminalization decreases rates of human trafficking in the countries that have enacted it. There is no reason to keep sex work in the U.S. criminalized other than the antiquated view that it is wrong.